Next, let's look for some of the major endocrine glands. Many of these major endocrine glands can be located on your torso models. We're going to start at the top and slowly work our way down. So for the beginning, I need to reach up here and grab a brain. Okay. So here we look at this sagittal section of the brain. There are two endocrine glands I want to draw your attention to with the brain, and those will include the pituitary gland, or actually there are three. The pituitary gland, right? And the pituitary gland is divided into an anterior portion and a posterior portion, and it hangs down from the infundibulum from the hypothalamus. And the hypothalamus is a part of your brain that also acts like an endocrine gland. It will make and secrete hormones that will travel through a series of blood vessels called the hypophyseal portal system down to the pituitary gland. The final gland I want to draw your attention to in the brain is back here. It's part of the diencephalon. The hypothalamus is part of the diencephalon. So in the diencephalon, we have the hypothalamus, the thalamus, and the epithalamus with this structure here called the pineal gland. And of course, the pineal gland is the one that will make and secrete melatonin that helps you feel sleepy when it becomes dark. So those are three gland structures. Hypothalamus and the pituitary are master glands, and then the pineal gland that produces melatonin. Next, as we work our way down, we come to the larynx, right? So here's the larynx, and on either side of the larynx, we have this structure called the thyroid gland. And the thyroid gland is important because it will make and secrete thyroid hormones, T3 and T4. T3 stands for triiodothyronine or thyroxine, and T4 is tetraiodothyronine. Both of those are made by the thyroid gland, and just generically, you could say that they help regulate metabolic rate. Okay. Here's another view. We have this enlarged model of the thyroid gland and of the larynx and trachea. And on one side, we can see the thyroid gland with all of the blood vessels that go to the thyroid gland to pick up the products of the thyroid gland. But on the reverse side, we can see another gland, a little series of glands that are embedded onto the posterior surface of the thyroid gland. Here, and then there's another one down here. This is the parathyroid gland, and the parathyroid gland will make and secrete parathyroid hormone, which helps regulate calcium within the body, regulating the calcium that's found within your bones. All right, so we have the ones of the brain so far, recap. We have the hypothalamus, we have the anterior pituitary, we have the pineal gland, we have the thyroid gland, and we have the parathyroid glands. All right. Now, a gland that we do not see illustrated on here, but I want you to know the position of it. It would be located right here, just barely superior to the heart, and sometimes laying on the superior aspect of the heart. This is the thymus. And the thymus is a crossover gland between the immune system and the endocrine system. It will produce hormones, for example, thymopoietin, which will be responsible for regulating the immune system. Okay, it would be located in this area of the body, right on top of the heart. It's more prominent in children, and it begins to atrophy. It begins to become smaller in size as you become an adult. All right, So let's go down. I'm gonna have to remove some organs. All right, let me get rid of the liver here. All right. Oh, it doesn't want to come out. All right. And as I remove the liver, if we look on the inside, we can see a couple of more organs. Back here, these are the kidneys. And right on top of the kidneys, we can see the two adrenal glands. So the two adrenal glands are actually two or several endocrine organs in one. We usually divide the adrenal gland into an outer cortex and an inner medulla. The inner medulla is a modified postganglionic sympathetic structure, or a modified sympathetic structure. And it will make and secrete norepinephrine and epinephrine under the command of the sympathetic nervous system. The outer portion, the cortex, will make and secrete products like cortisol, like DHEA, dihydroepiandrosterone, and also aldosterone. And those are going to be hormones that are mostly associated with regulating the blood pressure. And then here we can see the pancreas. All right. So down here we see the head of the pancreas, and the head of the pancreas is always embedded into the first curvature of the small intestine. So the stomach, here we have the stomach, it would normally be attached there. And this first section of the small intestine is called the duodenum. And the duodenum will always curve sharply, right? And we'll have the head of the pancreas. Then we have the body of the pancreas. And finally, the tail of the pancreas will point over towards the spleen, which is a lymphatic structure. So here we have the pancreas. And as far as the endocrine system is concerned, we think of, well, several hormones, but the top two hormones associated with the pancreas will be insulin and glucagon. Insulin is secreted by pancreatic beta cells, and insulin will help reduce blood glucose levels, among some other things. The glucagon is secreted by the pancreatic alpha cells and will help increase blood glucose levels, as well as a few other things as well. But that is the main endocrine function of the pancreas. It'll also produce a couple of hormones that directly help regulate the digestive tract. The main job, however, of the pancreas is going to be to make and secrete pancreatic enzymes or digestive enzymes, and that's what this ducting system you see here is for. Most of the pancreas will produce pancreatic digestive enzymes that will be deposited into the GI tract in the duodenum. So it's going to really help out with digestion. But there are these small, really important endocrine structures in the pancreas as well. All right, and then the last structures, sorry, I'm going to undo this. The last structures are the reproductive structures. So let me get rid of this large, well, I guess in the male, I don't need to do this, right? So in the male, the reproductive structure is known as the testis. So the testis is, again, a crossover organ. It's part of both the reproductive system and the endocrine system. The testis will be important for the production of testosterone, which not only helps out with the formation of sperm, but it also helps with being just a general growth hormone. And it's one that helps, if you have a high amount of testosterone, you get more of a male type body form. All right, so over here we have the female, and for this one I am going to have to do a little more dissection. Just flew that across the room. All right, so that we can see the internal structures of the female. So there's a lot of female internal structures, like here we see the uterus, but what I want to do is I'm going to remove all of this structure here. Focus in on this structure down here. This is the ovary, right? So the ovary is going to be found down in the pelvic area of the abdominal pelvic cavity. And the ovary will be important both for producing the oocyte for the female reproductive system, but also for producing two other hormones, estrogen and progesterone. And both of these will be responsible not only for regulating the reproductive cycle, but also as general body growth hormones as well. So that's going to do it with a brief overview of the endocrine system off of the torso and the thyroid model.